here in the state of Ohio since 1997, there has been a tenfold increase, a 1,000% increase in the use of prescription opiates in our healthcare system here in Ohio. In 2010, if you took the total number of doses, divided it by our state's population, every single human being would have received 67 doses. In Summit County, the dose level is 71 doses per person. So we have a significant problem around the volume of prescription opiates that are being used in our state and here in Summit County. Summa Health has put together, I think, a pretty amazing conference about pain management, and they gave me an opportunity to talk about the scope of opiate addiction in Ohio and more specifically here in the Summit County area. It's important for people to understand that prescription opiates are virtually identical to the illegal drug heroin. They have precisely the same effects as heroin. So we have essentially a population that has been overexposed to a very dangerous, addictive set of class of narcotics. In terms of what we're doing, we think that the general population, the citizens of the state of Ohio, need to have a better understanding of how addictive prescription opiates are. There's certainly a place in medicine for prescription opiates, but we believe that they're being overused in our healthcare system right now. So that's point one. Physicians and other practitioners also need to have a clear understanding of how dangerous these narcotics are and alternatives to in the treatment of pain management. There needs to be a broader discussion about alternative pain management techniques that can be used as opposed to prescription opiates in the treatment of chronic pain. I think in addition to that, we have vast numbers of people in our state that are currently addicted to narcotics, and narcotics is kind of an interchangeable name for prescription opiates. We need to make sure that we have more appropriate treatment for those people who are addicted in our state. And there's another phenomenon called opiate-induced hyperalgesia, and that's essentially a fancy phrase for the fact that many people who receive narcotics or opiate medications for extended periods of time actually become more sensitive to pain. That's, I think, another element that people need to be aware of in terms of this particular issue. In many ways, for the treatment of chronic pain, opiates are not terribly effective. Now, I want to be careful here because there are clearly areas where opiates are indicated and should be used. People who are experiencing acute pain. If someone has a broken bone or they've just experienced a surgical procedure, in those situations, opiates are indicated and appropriate. And on the other end of the spectrum, those people who have cancer and have terminal pain, and in those situations, addiction is not the overriding concern, it's quality of life. And in many of those situations, opiates are also indicated and appropriate.
The prevalence of chronic pain now is again up to like 30%. So it's more than heart disease, lung disease, diabetes, asthma combined together. It's a big impact. Millions and millions lost of billions of dollars lost to fight the chronic pain and the complication of chronic pain, which mainly loss of function. So our idea of this program is is an eye-opener. What is the risk of drug use in Summit County in Akron? As Mr. Hall said, we're above the average for the state. We're not the highest, but we are on the radar, if I can say that. So we have to go for non-opioid strategies, non-opioid management. And we should prescribe opioids with appropriate strategies. Opioids are great drugs to control pain in selected patients, not in everyone. So we are discussing and reviewing the data to support other medications, what we call them adjuvant, medications that help pain, but they are not addicting or habit-forming. The role of interventions like injections to diagnose the pain, where the pain coming from, and then accordingly we can treat the pain, and when we should refer the patient for surgical evaluation to treat the cause of the pain. If we cannot identify the cause of the pain, or we took care of the cause of the pain, and the patient is still complaining of pain, then we call it a chronic pain disease. It's a disease now. Acute pain is a symptom. There is something causing the pain. Chronic pain is a disease. If the patient ends by chronic pain with disability, then it's a disease. We look at it like hypertension, diabetes. It's a chronic disease.